with TCM providers. We will also have a presentation about care management, requesting a care manager's name. We will have some information about the 1915 I services. We will hear from our CCH partners about the physical health portal and other topics. We have information about the electronic visit verification, the provider manual, and then we will have a time for a Q&A at the end. My name is Linda Hawley Isbell. I am the Associate VP of Provider Relations and Engagement and Provider Support Services here at Trillium, and want to welcome each of you to our meeting today. You will hear a little bit later from Chauncey and Kim. So I want to tell you a little bit about Trillium Health Resources. We are a tailored plan and managed care organization that manages serious mental health, substance use, traumatic brain injury, and intellectual and developmental disability services in North Carolina. And as part of our tailored plan, we also cover physical health care and pharmacy. And we also help uninsured individuals through our state-funded services. We cover 46 counties, and here is some information about the landmass and the total population. We currently have 54,105 physical health providers in our provider network. We have 14,103 behavioral health providers, 452 vision providers, 2,788 pharmacy and medical supply providers, and our providers cover all 100 counties in North Carolina. So you can see we have a very vast provider network. So wanted to let you know a little bit about the question and answer. You can use the Q&A throughout the meeting to ask any questions. We will have subject matter experts who are available to answer questions throughout the meeting. And then at the end of the session, we will go through and answer some of the unanswered questions in the chat, as well as have an opportunity for you to raise your hand and be able to ask a question live. There may be some questions that we don't have the right subject matter expert on the line today to answer that question, so we will take those questions back, and we will post a frequently asked questions document on our website. So this gives you a little bit of information about how to ask your question in the chat. And just a review, I talked about this a little bit last month, but for any new participants today, for our provider forums, we did a survey in the fall of 2024, and we collected data from our provider network about some of the topics that you would like technical assistance and education on. This was the list of the top 7, and we have presented on many of those. Today, we're going to talk about the physical health portal through Carolina Complete Health. And next month, we will have a demo of the provider directory. We also had many other topics that were identified in that survey, and those are some of the topics that we will be presenting on today. I'm going to turn it over now to Chauncey Dameron.
Thanks, Linda. This is just a cogwheel to give you a picture of what our tailored plan partnerships look like in their entirety. You can move to the next slide. First, we have Carolina Complete Health, which is Trillium's standard plan partner, and they're responsible for our physical health network, including primary care, specialty care, durable medical equipment, vision, long-term services and supports, non-emergency medical transportation, and non-emergency ambulance transportation. Then we have Centene Vision Services, which is our vision partner, formerly Involve, and through our agreement with CCH, they're responsible for our optometry network. Perform RX is Trillium's pharmacy benefit manager partner, and they're responsible for our pharmacy network. And Motive Care is Trillium's NEMT partner, and through our agreement with CCH, they're responsible for our NEMT network. And then last we have North Carolina Department of Health and Human Services, which is our oversight entity and responsible for managing the delivery of health and human related services for all of our North Carolinians. Some of the resources that are available, all the behavioral health contracted providers for Trillium are assigned a provider relations and engagement coordinator, and that is your first point of contact for any type of questions. Another resource that you can use is also contact the provider support service line. The number there is on the screen, and they are available Monday through Saturday from 7 a.m. to 6 p.m., including federal holidays. You can always email your provider relations and engagement um, coordinator or a network development through the network services support at Trillium NC. And then you also can review the Trillium Resources website, Trillium Health Resources website at the address on the screen. And I'm going to turn it over to Miriam. Thank you.
Hey, good morning. I'm Miriam Godwin. I'm the TCM Provider Network Manager here at Trillium, and I wanted to talk with everybody today a little bit about Tailored Care Management and our provider network of Tailored Care Management providers. So if you go to the next slide, thank you. So Trillium's Tailored Care Management Network is made up of 50 TCM providers, and they serve our members in different population segments. That is mental health and substance use disorder, and that is child and or adult. Also intellectual and or developmental disability, that includes all ages. Innovations waiver, that includes all ages. And then co-occurring, so that's mental health, substance use, along with IDD diagnoses, and that is child or adult and or adult. So different TCM providers specialize in different population segments. So not every TCM provider covers all population segments. So you as a provider, when you need to communicate with a TCM provider, we strongly encourage you to use this contact list that is linked here. We maintain this on our website and we routinely update it. It is a list of specific contacts at each of those TCM providers that you can reach to talk about TCM. So instead of calling just the general number for, I'm going to use RHA as an example, you can instead use this list, and that person may know nothing about TCM. But if you use this contact list, you will reach somebody who knows about their TCM program. And you can use those contacts to find out, who a member is assigned to for their care manager and things like that. Keep in mind that TCM providers are not required to have a live person answer the phone. So you may have to leave a detailed voicemail for them. Please encourage members that you work with to work with their TCM providers. We've heard reports that TCM providers will outreach a member and the member thinks it's a scam, or they've got the wrong person or something like that. So once you find out a member that you're working with is assigned to TCM and who they're assigned to, please encourage them to work with those TCM providers. A release of information is not required for basic coordination of care. So if a TCM provider contacts you to say, hey, I'm assigned to this member, we don't have a good contact phone number for them. Do you have one? You can share that information without a release of information. So please keep that in mind and not be a barrier to members trying to receive TCM or providers trying to outreach members. TCM providers are responsible for completing 1915I independent assessments. They're also responsible for completing a care plan or ISP. They are also responsible for submitting treatment authorization requests or TARs for most 1915I services. For all other services, it is the service provider's responsibility to submit any needed TARs. And some 1959 services do not require a TAR, and that's why I said for most 1959 services, they do the TARs. Lastly, on this point, we strongly encourage collaboration between service providers and TCM providers. We have heard from many TCM providers about roadblocks that they've encountered trying to outreach providers, trying to get their collaboration. So I wanted to take a minute just to please encourage everybody to collaborate with those TCM providers. It is their responsibility to help coordinate that member's care and link them with any needed services. They are not trying to take over what you're doing as a service provider. They are there as a support. So I wanted to really stress that for everybody. Next slide. I get a lot of questions about, can you add the TCM service to your contract? I would say probably weekly I get questions about, hey, can we add TCM to our contract? So only after a provider completes the certification and readiness review process specifically for TCM through NCQA, only after that will we add the service to your contract and start the TCM onboarding process. At this time, the department, because TCM certification and readiness review is overseen by NCDHHS and NCQA, not Trillium. So we work with the providers after they've gone through that process. At this time, my understanding is NCDHHS is not allowing additional providers to go through that certification and readiness review process. If you have any questions about that, please contact that email address listed on the slide, and they'll be able to tell you if they're opening any additional rounds for the certification and readiness review process. But I want you to walk away with understanding when you ask if you can add TCM to your contract, and we say no, it's not because we don't want you to do it. It's because you have to go through that certification and readiness review process, and we are not managing that. It is through NCDHHS and NCQA. So that's all for my slides. Let me see if there's any questions. Why does Trillium require providers to complete the TARS when all other LMEs include that in the role of the care manager? That is not a question I can answer, but I can speak to that care managers are responsible for doing TARS for 1915I. I don't know if anybody else wants to take that question. If not, I'm going to hand it over to Katie.
Thank you, Miriam.
Oh, hold on. Are we handling questions as they come along? I'm sorry, I can't remember.
No, we can wait to the end.
Okay, thank you.
Thank you, Miriam. My name is Katie Eves, and I am the Clinical Support Services Director. Next slide. So today I'm going to talk to you about the PCP provider request for care manager name or assignment process. And so Trillium, we developed a process for when, like, you as a provider, if you're like, hey, I need to know who this member's care manager is. I know they're with Trillium, but I don't know what the care manager's name is. Or you may have a member where you're like, I think they need care management, and you're check NC Tracks. NC Tracks says that they're assigned to Trillium for TCM. This is the process. So the first part of this is just, we do encourage everybody to check NC Tracks first to make sure that they see that the particular member is assigned to Trillium as not only as the TP or PHIP, but also that they're assigned as the tailored care management entity. So you can get this information and the link that I have a variety of ways. One is you can go to our website, and I have how you can find the website. You can just use the link that's directly here, or you can also contact the provider support services either by phone or email, and they'll provide you with the link. Next slide. So after you fill out that link, it's a basic referral form. It's going to have information regarding, member's name, Medicaid ID number, date of birth. Basic information also has kind of drop down of things like, hey, what what are you needing care management for? And so it's a fairly easy form to fill out. And so after the referral form is submitted, the clinical support team, we receive the information, and we will provide a response to you within 3 business days. And so the type of response, though, that you will receive will really depend on whether the member is assigned to Trillium Health Resources or a provider-based entity for telecare management. If the member is assigned to a provider-based care management entity, then the clinical support team will provide the name and contact information of the provider-based care management entity to the individual who submitted the referral, and we do that via email. And so kind of basic, similar to what Miriam said, there is that link on our website that has all of the contact information for providers. That's where we get the information on their contact information that we send. If the member is assigned to a Trillium Health Resources care manager, then we will respond to you and say, this is the name of the care manager, and we also alert the care manager of your request. Next slide. So if the member is assigned to Trillium for TCM, but does not have a assigned care manager yet, then the clinical support team will submit a referral for care management services. We will alert you that, like, hey, you received this referral from you regarding Johnny, and Johnny does not have an assigned care manager. We have submitted the referral for care management. So the time frame from when the clinical support team, so when we submit that referral, the average turnaround time is 3 to 5 business days to get a care manager assigned. So once that happens, if a care manager is assigned, we will let you know, hey, this person's been assigned, this is the care manager's name, and we'll also alert the care manager of that you would contact in your name and contact information. It's important to note that the care manager is going to reach out to the member first prior to reaching out to you. So if you submit something and this is a brand new member to care management, they need to get TCM consent first. So they're always going to talk to, reach out to the member first. So that if there's, they may have someone referred within 3 to 5 days and have someone assigned, but that doesn't mean that the care manager can always get in touch with the member. So there's times where, the contact to you may be delayed until that care manager can reach the member. If the care manager is not assigned, the clinical support team will email the referring person and say, hey, this person was declined for care management, such as, if someone has a duplicative service where you're not supposed to have care management and at that particular service at the same time, we will alert you of that. It's really important to note that if you have a member who is in an emergent or urgent situation and that care management assignment needs to be expedited, or if you're a hospital and you need to refer a member who is on an inpatient unit or an ED, then you need to contact the member and recipient line. Because as I kind of talked about, this is a process for people when someone is not in an urgent status, because there is a delay with us reviewing, responding, and everything else. So we always want to make sure that you do it. If you have an emergency, call the member recipient line. Next slide. I'm going to mimic something that Miriam said earlier, that we really recommend you alert the member of the submission that you requested a care manager or the name of the care manager. Because we do have, as Miriam said, we have a lot of members who, they don't answer the phone if they don't recognize the phone number. I don't always answer the phone if I don't recognize the phone number, or they think it's a scam. And so informing that member, hey, you should be getting a call, that's really important, because it really helps speed up the engagement process and making sure that person is linked to care management. If you have not received an initial email response, check your spam or junk folder. We have all the emails that we send obviously have PHI or PII, so they're all sent encrypted. And so that initial email response, you should always get it within 3 business days. Usually it's the same day or the following day, but always within 3 business days. And so we want to make, if you don't have that, always check your spam folder. If you have a personal care services questions or needs, then we recommend that you go to the Trillium Health Resources personal care site, because that would provide a lot of information, and also kind of what to do if you have a PCS question versus needing the name of a care manager. And then I also put some website information here that talks about, from DHHS and also Trillium regarding TCM. And I believe that's my last slide, and I'll pass it off to Katina Dial-Scott.
Good morning, everyone. I'm Katina Dial-Scott, Associate VP of Operations, IDD and LTSS Services. First question is, what are 1959 services? 1959 services are home and community-based services. They are free to members who have Medicaid who want to live in their home communities. These services are non-medical behavioral health services. They are provided at a member's residence or community and are not for members living in an institution. 1959 services replaced B3 services, which were no longer available. We can't even bill them after December 31st, 2024. 1959 services, federal conflict-free care management requirements state that the same provider cannot offer TCM and 1959 services to the same person. Individuals who are enrolled in CAP C or CAP D can receive some 1959 services. Members cannot receive respite or community transition, but are eligible to receive all other services. Here we just have listed, and I have the clinical coverage policies noted too for all the different services. I won't read into detail with these, but they are here because I know you guys will get a copy of this for what is a quick reference to what each service is. Next slide. Eligibility for 1959 services. Of course, it's North Carolina Medicaid Direct, Tailored Plans, EBCI, Tribal Option, and the Children and Family Specialty Plan when it launches. Members on the wait list for innovation services can be eligible to receive 1959 services while they wait. Members are not required to meet an institutional level of care to be eligible for 1959 services. Members who are not eligible for 1959 services are your recipients of standard plans, North Carolina Innovations, or TBI waiver members. And basically, here's a chart that was a courtesy of the division and AHEC that kind of spells out the different ages for the different services they can receive and their populations. Next slide. Okay. The process flow for 1915I, of course, there's identification of the member, which is you see a member, you're working with them, and you feel like, okay, they could benefit from the service. That's the first step. Then, of course, we have to get the assessment completed. The 1915I is completed by TCM and submitted to Carolyn for review. This could, I know we have gotten questions in the past as far as the evaluation. And some folks have asked, how long do we wait? They're saying it takes about 2 weeks for Carolyn to do their evaluation of that assessment once it's submitted. And if you hadn't heard anything back, it's always good to reach back out to them for a status update, because I've seen where folks have submitted it and it's months later and they're not following up to see what's going on with this. And it's like, okay, it shouldn't take months. The division has told us it's a 2-week turnaround, because sometimes I guess folks have thought they have submitted it. Then when we check with Carolyn, they never got it. So there may have been some kind of error in submission. So you always want to make sure you're following up within that 2 weeks if you're not getting a response or any kind of status update. Or as the care plan, TCM assistant member would identify a 1959 provider that developed a plan. They ensure the plan reflects the member's needed services and supports, preferences for delivery of services, and the name of the service provider. It must be completed 60 days. Calendar days of TCM consent for all new members for 1959 goals are added. TCM and 1959 service providers should collaborate to develop the member's care plan, ISP, and share a copy once it has been completed. And they do that together to ensure accuracy and that there's no barriers to the member getting 1959 services. As previous presenters have stated, there needs to always be a collaboration between the two providers. The two providers should be working together to make sure what is needed on this care plan for that member to receive their services. We've gotten questions where the care plan is submitted, they're missing crucial elements that cause barriers for members to get the services. So they need to make sure, and that's working together. Let's review it together. Let's go through it together, make sure all the elements are there so we both can proceed without any kind of barriers or having to come back. And so that's very important. Prior authorization, TCM submits a completed care plan, ISP, for review. UM conducts a prior authorization of 1959 services. Providers should not bill 1959 services until a member has been deemed eligible and authorized for services unless there is a no prior authorization required. Service delivery and care coordination is a TCM 1915I service provider work together to implement the authorized services according to the plan that they developed. TCM provides ongoing care coordination. If a member has opted out of TCM, care coordination staff can complete these tasks because we have a number of members who don't want TCM, but they do want 1959 services. Next slide. We had a clinical communication bulletin number 70 to go out December the 20th, and it went in effect for January 1, 2025. And basically, two of these services, which is your IPS and your ITS services, no longer require a TAR for prior authorization. But you still need to have a 1959 assessment completed and approved, whether there's a prior authorization in place or not for these members. There has been some confusion around that, where providers have tried to bill for these services, but they've not been even approved for the service. So that, of course, results in denials and miscommunications, understandings. So make sure that assessment is completed, it's approved, even if there's not a prior authorization needed. Next slide. This is just a listing of the services that require prior authorization. I'm not going to go in all this, but there is a link here that'll take you to our iOptions benefit plan. And so you can review that. And this is the ones that require no prior authorization. And again, the link is there for you to review the whole plans if you need to. Next slide. Okay. Providers should not bill 1959 services until a member has been deemed eligible. We cannot stress that enough. So when submitting the 1959 service claims, ensure that you are using correct codes and site location for services, because we have had folks who not submit that information, which resulted in denied claims, or they've put the wrong site where the services were actually provided. So make sure when you're submitting those things that they're submitted correctly to avoid any issues with claims. Next slide. And this here is just some resources, trainings, and templates that we have available to kind of help in getting documentation completed for members for the ISP. There's a template, there's TCM trainings, resources on the My Learning Campus, and then there's also North Carolina MAHEC has lots of different resources that are available to help. Next slide. Here I listed 1959 provider resources that you may be able to use and find beneficial in working with those members. And I know our previous representatives talked about NC Tracks. It's our last bullet there. And be able to see who the TCM assigned staff is. And if it is, of course, Trillium, then you would need to submit this link here. And basically, I can tell you that comes to my department, and we can tell you who at Trillium is assigned to that member, because NC Tracks is only going to tell you their Trillium. Okay, I'm going to hand it off to Gaines Carey for the next section. Thank you.
Good morning, everyone. My name is Gaines Carey, and I am the Education and Training Coordinator for Carolina Complete Health. Today, I am going to be going over the Trillium Physical Health Portal and some prior authorizations. We really encourage providers to utilize the Trillium Physical Health Portal to access important information like beneficiary eligibility, health records, prior authorizations, claim status, and more. To access this portal, please visit this link here. Once there, you can either log on if you have an account already or create a new account. To create a new account, you will need your tax identification number and a working email. Next slide, please. So once the account setup is completed, the portal user will log in with their username and password. The portal registration page will display. Once you have completed the registration, the account manager can verify access. Most importantly, if there's no account manager, you will need to reach out to your provider engagement administrator to finalize setup. Next slide. So basically, this is just sort of an overview of what I just said. I want to highlight the importance of an account manager to each 10. You definitely want to contact your provider relations rep or provider service at 1-833-552-3876, or again, email the provider engagement to get this set up. Next slide. And now we're going to talk a little bit about what an account manager is. You can go to the next slide, please. Basically, this person is responsible for the day-to-day support of all users. Most importantly, they can add or remove users. Next slide, please. This is basically a screenshot once you log into your portal, the home screen. If you look at find your name on the top right screen, you can do the drop-down bar and then select user management. From here, you can add user, you can remove a user, or you can add a 10. Next slide, please. Same thing, you can also invite a user. You can search a user's name up by last name or email. And then if you select the verification pending, you can see who is requesting access to the portal. Next slide. So let's go over some important tips as the account manager. You should log in at least every 90 days. But of course, if you're the account manager, you should log in more frequently. This allows your agency and practice to be more self-sufficient because of how much the account manager is able to do. The big thing is you can also disable users as well. Next slide, please. So I want to just take a minute. If you do utilize third-party billers, it's very much the same process. The account manager will need to invite this third-party biller. They will then register and set up the exact same way as anyone else would. Next slide, please. So now we're going to go into a little bit about prior authorizations. If you need a prior authorization, you can either use, again, the portal. We also use Availity, as well as you can call it in or fax. Next slide. To check if a prior authorization is needed, we've got this great tool on our website. This link is located here. You will answer some questions and then place the code in the box, and you will have immediate response for whether or not a prior authorization is needed. Next slide. Here are some required prior authorizations. This is not an all-inclusive list, but it's definitely a good starting point. The things that I want to point out is that if you are out of network, prior authorizations are required, with some exceptions listed here. Next slide. For the purpose of today, I know there were some questions about some surgical authorizations. This is the necessary information that you will need. Of course, you will need the beneficiary name, ID number, taxonomy, the facility name, the reason for the authorization request. If it's a planned surgical procedure, you will need that date, and then an admission date, as well as discharge plans. Next slide, please. So these are some authorization tips. The best practice is always to get eligibility before submitting the auth. The portal is the most efficient way to submit an authorization. Its advantage is that it's placed into that queue right away, and it's processed pretty quickly. You can attach up to 5 documents. When you're on the auth page, Sometimes, this is very rare, but I did want to point this out, that there will sometimes show up as an auth error. This is not common, but if this error does occur, it means it didn't load and you need to redo it. So let's go to the next slide, please. And here are some determination timelines. The big thing is if you want to request a PA for standard service authorizations, you need at least 14 days prior, and the decision will be made within 14 calendar days. For surgical authorizations, it's about the same. You'll need 14 days prior, and the decision will be made 14 calendar days after. Next slide. Claims and payments. This is kind of a silly slide, I feel, or not silly, but I like to read the definition of a clean claim. A clean claim is a claim that is received for adjudication in a nationally accepted format in compliance with standard coding guidelines and does not have any defect, impropriety, lack of any required documentation, or particular circumstances requiring special treatment that prevents timely payment. That is what we consider a clean claim at CCH. There are some exceptions if there is fraud suspected or there is a third-party payer. And also, if you see paid in full, that just means the claim has been adjudicated, processed, and reimbursed in accordance and with the executed provider contract on file, including the coordination of benefits as applicable per claim. And again, you have 365 days to submit this from the date of service or date of discharge. Next slide, please. Submission methods for the physical health claims, again, are the portal, Availity. You can also use a clearinghouse, and our payer ID is 68069, or you can mail here to this address. Next slide. So the next few slides are portal functionality. You could go ahead and go to the next slide, please. For claims, I just want to point out that from any screen, you can select claims from the top, icon. From there, you'll be directed to quick actions, and then you can also select any prior authorization needed or eligibility or create new claims. Next slide, please. So from there, it will bring you to the claims home screen where we have the tabs in a horizontal row. It will automatically display individual claims by 30-day increments with the most recent claim first. You can also filter and change the date ranges and view up to 24 months back. If you click the filter button, you can also view claim by status, type and bill amount. It can be less than or greater than, and you can also use the search option to find a specific claim number or search by a specific member or provider. Next slide, please. So from the claim screen, if you click any claim number, it will bring you to the detailed display for the claim as you see here. This will summarize what was billed, how it was billed, and the status of each claim. Or I'm sorry, the status of each line item on the claim. Next slide, please. When the claim is adjudicated, you will have the options to either correct or reconsider the claim. Reconsideration is the first step in the physical health claim dispute process. Next slide. And then here is our next tab, the Save tab. This shows us the claims that were started but never submitted. If the original claim number column, if it contains a claim number, that means a correction was started on a claim but not submitted. So it stays here in a draft. And then the last row from here, you're able to edit, complete, and submit or delete. Next slide, please. And then the Submitted tab displays individual claims submitting using the portal, pretty much similar to how we filter the claims on the home screen. Next slide, please. And next slide. Basically, to create a claim, you would click Create Claim, enter member ID, member's birthday, and click Find. Next slide, please. Here you would select which form you would want to use for creating the claim. Next slide. You can, sorry. I don't think I need to walk through every bit of these slides, but I will just give you a brief overview. Your progress will be showed at the top. And I just want to point out that the boxes on the right side are similar to the paper claim form. Next slide, please. Important here too, this is where you would submit your COBs to submit a secondary claim. Next slide. And then if you want to add new services or enter additional service lines, this would be on this third screen. Make sure you save and update. Next slide. And then this is just a tip. Make sure you put your taxonomy. Next slide, please. And important to note that you can attach up to 5 attachments. If you do not have any, of course, you don't need to put them in, but you have the option of submitting 5. Next slide, please. And from here, you would just, if you have the option to edit and go backwards and make changes, if you're satisfied, then you can, of course, submit here. Next slide. And then we ask that you just take note of the confirmation ID once the claim is submitted. Next slide, please. There was a question asking about EOPs in the physical health portal. Again, it's that you can always start with that claims button on the top. From there, you can select manage finances, and then it'll populate from there. Next slide, please. We did get some questions about overpayments. We do recommend at CCH that you do self-audits voluntarily and just kind of assess if anything's been incorrectly paid or if you see anything of like fraud, waste, and abuse. If you do notice anything, just please, we ask that you notify us within 60 days of identification. Next slide, please. This is a slide that just really lists some key contacts and resources. Next slide, please. We do offer at TCH some additional trainings. We did just host a PCS provider training last week, which had a lot of information, and you can click these links to access that information as well. Next slide. And here's just some additional resources. Next slide, please. And that's all I have. Thank you. And I'd like to pass it over to Stacy now.
Hey, good morning. I'm Stacy Lassiter. I'm one of the claims managers, and I will be reviewing electronic visit verification. Next slide, please. So what is EVV? EVV stands for electronic visit verification, and it is a method used to verify home health care visits to ensure that the members are receiving the services that they have been authorized to receive. It is part section 12006A of the 21st Century Cures Act, and it is mandated that all states implement EVV for all Medicaid personal care services and home health care services that require an in-home visit. This applies to PCS provided under sections 1905, A24, 1915C, 1915I, 1915J, and 1950K, and section 1115, and home health provided under 1905A7 of the Social Security Act. And the next link is a link to Trillium's website directly to an EVV page where we have terms and acronyms, a Q&A, and a tip sheet. So that's really helpful there for any questions you may need answered. Next slide, please. So this next screen just talks about HHA Exchange. So Trillium contracts with HHA for their EVV software. And I have included the onboarding form link as well as the link for the LME portal questionnaire that will need to be completed if you have not already signed up with HHA Exchange. I have also added links for the HHA knowledge base that has job aids and resource links, a link to billing if you need questions answered or need to see how to bill in HHA, and also a knowledge base for providers that are using third-party billers for their EVV vendors. So if you do use a third-party vendor to submit to HHA, just make sure that they are using the correct payer ID so that your claims are routed to the correct portal. And we have those listed there. Next slide. So PCS services are currently under a hard launch guideline, which means that they are expected to be fully compliant with EVV requirements. All EVV data must be validated prior to claims adjudication, and claims without required EVV criteria will deny. So you must make sure that that EVV data is attached to the claims when we receive those, or those will deny. For home health services, they're currently under a soft launch. We're looking at a possible hard launch of July 1st, 2025. That is not a set date yet, just possible. And home health providers are encouraged at this time to submit EVV visit information into HHA. And that's just so we can make sure that you're not hitting any billing submission issues. And we can resolve any barriers that you may be hitting prior to go live or hard launch. EVV data elements through HHA are still required, even if you're going to use the direct bill option. So you will be allowed to direct bill to Trillium, but then you will also have to make sure that your visits are submitted in HHA so that we can get that required EVV data that's required on those claims. Next slide. So in HHA, Trillium has turned off the auth required function, which just means that you do not have to wait for your authorization to be loaded into HHA to submit your billing. Your visit will show red and will warn you that there's no authorization there, but you can still move forward to go ahead and submit your billing. So if it is an auth required service and you know you have that authorization, you don't have to wait for it to be loaded in HHA. You can go ahead and submit your billing there. And then I just have another link here that will take you to a page that lets you know what services require the EVV elements. And then we also have a link here that's claims support at trilliumnc.org for any questions on EVV claim denials, or any denials, period. But if you are asking about EVV denials, if you will put in that subject that it's an EVV question, and then those can get routed to the correct department to get those answered. Next slide. And that's all I had for EVV. So now I will turn it over to Greg. Thank you.
Good morning. My name is Greg Conover, and I'm one of the network auditing managers, and I'm going to review the provider manual. The provider manual is available on the Trillium Health Resources website and the Provider Direct portal. The provider manual outlines how to do business with Trillium. It includes the processes and procedures we expect from you and tells you what you can expect from us in return. It is our intent, that the provider manual is a living document for Trillium staff and our provider network. Trillium regularly reviews and updates the manual annually with a submission date due on July 1st. But we can update if there are requests from any of the departments, or there's any changes in the federal rules, laws, and regulations as necessary. And Trillium keeps the provider network apprised of any new information and procedural changes on an ongoing basis to ensure providers are up to date and understand revised expectations as they happen. We send those messages through our email distribution via constant contact, So please be sure at least one staff person in your office signs up and receives those updates. Next slide. A printed copy of the information posted on our website is available if you contact Trillium at the following number. The provider manual can be located at the following locations on our website: Trillium Provider Direct under Resources, and Trillium website for providers, documents and forms, and we'll give a brief demonstration of that at the end of my presentation. Next slide. And this slide and the next two slides are just a sample of what the table of contents are in our provider manual. There are sub topics underneath each one of the table of contents. I just did not include those for time constraint. Jonathan, can you go to the website? So when you click on our website, you would want to go to providers, and then on the left, there's an overview button. You'll want to click on that overview button and then scroll down, and that will take you directly to the provider manual. That's just one of the ways. From there, you can open the manual and you can download it, or again, you can contact Trillium for a copy of it. But just keep in mind that we do update it, as there are changes. And of course, once you open it up, it'll take you to the different sections. I believe there's 100 and I can't remember, 150 some pages. So and again, as you can see, there are different subsections under each one of them. Thank you, Jonathan. And the next two slides, again, are part of the table of contents. Next slide. And I will turn it back over to Chauncey and Kimberly.
All right, thank you, Greg. We appreciate that. Thank you for all of your questions. We do have quite a few in the Q&A, and I will start at the top and see if we have a subject matter expert on who can address the question. If not, we will take those back and then answer them, providing them on the website with the recording from today, the slide deck from today, and then the Q&A from today as well. So the first question we have that is not yet answered is, why does Trillium require providers to complete the TARS when all other LMEs include that in the role of the care manager? Is there anyone from Trillium that can answer that?
Really, I think that's one that we're going to take back.
All right, thank you. Okay, the second is, why can we do, or who can we speak with when TCM schedules meetings with members and does not include the provider? When TCM is asked why the provider is not invited, they say the member did not ask for the provider to be there. And I believe that Miriam did address that one. A member may choose not to have the provider be a part. Okay, so my apologies. I did not see that a few minutes ago. And let me scroll. Looks like we have the majority of them at this point answered. Chauncey, do you see any that I do not see?
I'm looking. I think I see one. Well, never mind. I see Miriam did answer that one.
Let's see. Here is one. I do see. Who do you contact to become account manager? Both Trillium and CCH are sending me to one another. That is from Judy. And Judy, are you speaking of becoming an account manager for the portal, so that you can manage your internal staff there. And I don't know if you want to come off of mute.
I think we will have to take her off of mute, Kim.
Right, Jonathan, I believe. Jonathan, is that something you can do for Judy Skinner?
Yeah, trying to find her on my participants list. Give me one
Gotcha.
second.
If you can raise your hand, that would help us.
I do have one raised hand from Dr. Karen Kirk, so I will unmute you or send a request to unmute.
Okay.
Probably not any question that y'all haven't answered to yet, but given the NC Tracks message yesterday about, delayed payments from them because of federal delays, can y'all speak yet to anything that we're going to be worried about with Trillium being able to pay us as providers?
I don't have anyone on the line today from finance, but we can definitely take that question back.
Okay. I know that my providers, we're seeing too much that makes us nervous. And I'm sure, we read the NC Track stuff all the time that nobody has answered yet, but we'll appreciate anything that Trillium puts out to us as soon as y'all know it.
Okay, thank you.
Thank you.
And did we locate Judy?
Yeah, Judy, I am sending you a request to unmute.
Yes, are you there?
Yes.
Yes, it's for physical health. We have been trying to register our TIN through the portal, and it is saying that we are not registered and then we are unable to do it. I called Carolina Complete, they send me to Trillium. Call Trillium, Trillium sends me back to Carolina Complete. However, I've not been able to get into the physical health portal. And this has been going on for about 2 months now.
Okay.
Hey, I can answer that. I'm sorry to hear that. If you could provide an email information for yourself, and I will have provider engagement reach out to you to help you troubleshoot that. And we
Okay.
can get squared away.
Do I put it in the Q&A?
Yeah, if you would do that, that would be great. And then from there, someone could reach out to you, and then we can get some your tax identification number and get some other key information, and then they can troubleshoot that with you and get you access to the portal.
Okay, thank you so much.
You can put it in the chat, Judy. The chat,
Okay, thank
not
you.
the Q&A. Yeah.
It looks like the next question we have is from Antoinette Cooper. In Provider Direct, we can see authorizations that were directly requested internally. I am not seeing any by the care managers when using the search TARS feature. That question and the one below are similar. We are unable to see when a TAR is being submitted by a care manager. We can see an authorization is approved, but it would be beneficial to know when a TAR is submitted. Do we need to take that back as well?
This is Karen. You could take that back to IT, but I do not believe there is a way for TAR submission to be viewed by the service provider if the TAR is submitted by the care manager.
Okay, thank you. Okay, thank you.
I think the next one, Kim, is George Rios.
Yes, should there be one or two plans for 1915 ICLS? Some TCMs are stating they write an ISP, and then providers should write a separate plan for short-range goals and interventions. Other TCMs are including short-range goals and interventions in their ISP, which is correct. And I believe that, we'll see, Katina, are you still on?
I am, but I'll have to do some research. I don't want to give out the wrong answer.
Yes, ma'am. Okay. And then George has the next question. Who is supposed to sign the service order for 1959 services that can be ordered by a QP? Some TCMs are signing, others are stating the provider must sign the service order. So I'm guessing that's the same. We'll take that back. The next question is from Gina Tanner. Some care managers from Trillium are not getting annual ISPs completed in time, having incorrect or missing information on an ISP, etc. What is their caseload? Is there a shortage of care managers or CM extenders assisting? And then providers should not be expected to routinely remind them. And that
is a question we definitely have to take back.
Right.
And let me see, Gina, do we have your contact information in case we need to ask additional information? If you could put that in the chat, just in case we have additional questions.
Thank you, Katie.
Mhm.
Okay. We'll see. The next is there are several questions involving innovation services that were asked last month and are asked again this month and there are still no answers. When can we have innovation specific conversation about Trillium's plan process and authorization? I can let you know that we do apologize for the delay in the Q&A from last month. That is ready and should be posted today. However, if there is anyone that can address specific conversations.
Or if you can clarify a little bit more about what technical assistance is needed, we can look at adding something in an upcoming provider forum.
Thank you, Linda. Okay, the next question is, what if Medicaid is cut? Will clients be allowed to enroll in IPRS? Will IPRS be able to cover the cost? And I know pretty certain we don't have an answer for that one, but we can take that back as well.
Yeah, we wouldn't have, this is Sharon with utilization management. We wouldn't have an answer for that one. And I'd just like to piggyback on some of the 1959 questions that Katina's taken back. I just would make sure everyone is using the NC 1915 fact sheet on the division's website. It has lots of these answers from the questions asked today. And for any innovations questions, if you have specific ones, I'm happy to try to do that. We did move back to no prior auth needed. You guys probably saw that communication. So if you need something else, let us know.
All right, and Sham, is that the provider playbook fact sheet that you're talking about?
That's correct. Okay.
I can.
And they have examples in there of, when an ISP is needed, when a care plan is needed, when a PCP is needed. So at the end of it.
I will put that in the chat. I'll put that link in there for everyone. Okay.
We have one raised hand.
Okay.
Chowun, I'm sending you a request to unmute.
Hello. Can you hear
Hi.
me?
Yes.
I got a question about TARS. My agency had been submitting TARS for a while, just to practice, before that we supposed to have submitted them in February. And so then we submitted them all in February, it was fine, and then we submitted them in March. and then the no prior authorization thing, came in effect again. And the system has been sending me back, like they UTPing them, and they saying they're sending them to specialty care, and they're sending them all these places that they wasn't sending them prior to that. So can somebody explain to me what does that all mean? Because they're saying now unapproved. Like before they was in effect, they were just going through like regular. I've seen TARS many years, and they were doing fine. So after the no authorization, I don't know if you have been instructed to do something different, but now all of them are saying unapproved, modified, denied. I mean, just weird stuff. So is there anybody that can explain what that means? I'm assuming that since there's not any no prior authorization, they just pick something and send it back, but it's confusing to providers.
This is Shan with utilization management. We would need to look at the TARS you're talking about, as we can't answer in general. And no, I'm hoping we should not ever be picking something and sending back. It should be specific to this information submitted, the services requested, and the clinical documents received. We do have
I typically provide pretty much the same service, and so like originally they were just like kind of going through and just fine, and now I got they're it's the same service. It's different reviewers, and some of them are picking and sending them to the special, saying this is a service in specialty care, and then some of them are saying you don't need to send this because no prior authorization, and some of them are saying.
I tell you what, I'm gonna put my email in the chat. So it seems like it could be an off conversation that we can have offline. So you can email me directly, and I'll get my team to help you out with that.
Thanks, Sham.
Hello. Did you hear that?
Yes. Sham is going to put her email address in the chat so that you can contact her specifically, and her team will assist you.
Okay, thank you.
Let me go ahead.
There's a couple of questions about Provider Direct, which I know we'll need to take back, so please know that we'll take those to our IT team. The next, it looks like from Leslie, for 1915I members, is there a way to transition ISP effective dates to coincide with member birth dates so authorizations align, just like innovation member annual rhythms? It would help from a planning perspective to have consistency in authorization rhythms. Okay, is that one we need to take back as well?
This is Shan. Originally that was something that was suggested by the department, but that means creating, updating the assessments, because 1915I has to be done annually. If the member became eligible in July and the birth date was in August, they would have to renew and do a plan again in August, and they have to make sure the reassessment was done twice. Does that make sense? So you'd only be eligible until July. So it means creating a different plan and doing a different assessment twice. So it becomes difficult to do that. I don't know if that helps or makes any more sense, but the eligibility only lasts a year. So until you can get that on the member's birth date, you may have to do it twice in a year. Does that make any sense?
Mm-hmm. Does to me. Leslie, if you want to raise your hand, if you have, okay, she's given us a thumbs up. So, okay, good. All right, the next question is from Mickey. We are a behavioral health provider that have nurse practitioners on staff. We are repeatedly told that their claims have to be submitted as physical health claims. All documentation states that I believe that a combination of taxonomy and diagnosis will be used to indicate that a claim is a behavioral health claim. We submit a behavioral health diagnosis. Is this ever going to change?
Hey, this is Stacy with the claims department. Let us take that back. That is based off of the guidance from the state. how they have that divided up between behavioral health and physical health. So let us take that back and we'll get that answer back to you.
Thank you, Stacy. Okay, and it looks like we have one more question in the Q&A. Is anyone at Trillium tracking how many lapses in services are occurring because TCMs are not completing plans and getting authorizations in a timely manner? Almost all of our members on 1915I are having weeks of lapses. Okay, and I know that Miriam did have to drop off for another meeting. So if no one is able to answer, we can take that question back to her.
That would either be Miriam or, and for person who
Katina.
submitted that, I was either Katina, or are you referring to Trillium care managers or provider-based care managers, or both?
Yeah, that would, George, can you answer that for us?
He did. He said both.
Oh, gotcha. I see.
So
what I would say related to this is we do have reports out on lapses of eligibility that we do submit on a regular basis.
Okay. All right. Are there any other questions? If you do have a question, you may raise your hand. Okay. Do you see any hands?
Two raised hands come in. First from Mary Claire Rigsby. I'm going to go ahead and send you a request to unmute.
I'm Claire Rigsby here at UNCMC. There's actually three questions that I had asked. The first question is, does Trillium have a short-term care rehab? Are you guys allowing that for a patient if they have? I know historically it's long-term rehab for Medicaid. How about short-term care rehab?
Is there anyone
And we'll have to take back.
Yeah, I was going to say, if there's not, and are you speaking of physical health rehab?
Yes, like physical health, not acute rehab, but patient going to a skilled nursing facility for a short term, not a long term.
Okay, thank you. And you said you had other questions?
Yeah, the other two questions, UM questions, it's specifically for behavioral health, and I don't see a behavioral health UM in here. So I can just email those to somebody because it's a lengthy one for both.
Okay, if you want to send those to UM at trilliumnc.org.
UM at Trillium.
Yes.
Okay.
And I can put that
yeah.
in the chat as well.
Yeah.
I'll type it.
All right, thank you.
Thank you. And what's fascinating is that physical health is saying that if we can either do portal or faxes, and we have issues in submitting clinicals through the portal for behavioral health. So we started faxing it, and they did not want to take the fax from us because of contractual issues, but we're having issues in the portal. So what is our next steps for those kind of situations? This is behavioral health though. But.
Okay. Yeah, thank you for sharing those. And if you want to go ahead and send those questions, we'll make sure they get to the right person.
Okay, thank you.
You're welcome.
Right,
Jonathan?
next up we have raised hand from Devin Cornett. Gonna go ahead and send you a request to unmute.
I missed this, but I had put a question in the chat at 10:50 about the EVV, and when it was initially launched in the CLS all service codes for authorizations, doesn't appear to be an available option anymore. And is this going to be reinstated?
Okay, I'm looking just to see. You said 1050, 50?
Yes.
Okay.
And I didn't see an answer. I was like, well, maybe I missed it. So
There's a lot of questions, so bear with me.
What's your name?
What's your name?
Devin Cornett, DEVONCORNETT.
I don't see the question.
No.
Wow. I'll try. Yeah.
Would you mind putting it in the again and
Sure. I can, yeah, I don't think it'll let me copy, so I'm gonna have to retype it, but it's.
I'm sorry.
Sorry, putting it again now. But it was regarding for CLS, there's T2012, T2013, there's different modifiers and codes between 1959 innovations, but for both of them. So when EVV was first launched, there was an all service code or a bundled off that was implemented statewide, so that if a parent was doing 10 hours a week and your other DSP is doing 30 hours a week, those are two different codes, right? So every time that changes, you'd have to get a new authorization with the way it's currently set up, because you don't have that flexibility anymore like you had under the all service code. I'm going to retype that, but that's what the question is about.
Okay, thank you. I apologize. I'm not seeing it.
Stacy, do you want to respond to that, or we take it back?
Yeah, I'm not going to be able to answer that because it's related to auth. I think she was asking about how requesting the auth.
Yes.
Yeah, I won't be able to answer auth.
How to request the auth, it's just the type of, like, it's a bundled auth. So all the codes, like, it'll all fall under one authorization. So if I bill T2012 for 20 units, it'll come off that same auth. And if I bill another 100 units under T2013, it all comes out of one auth because it's the same service. There's just different modifiers.
This is just a system setup for us.
Yeah.
And I'm gonna again use the sham.trillium.nc.org. It's just completely, it's just a different setup in our Trillium business system. So you can request the max amount of units that you need by each one, and then use as you can appropriately, and you should be fine.
So you've just, okay. I think that causes a whole other issue, but and I'm not, you said that really quick, and I thought I talk quick too. I might need a little more guidance on that.
Okay, just email me directly at sham.trail, what you said earlier, and I'll double check with my benefits team again on this, but it is related to the system setup in Trillium's business system. And I'll make sure I'll get my wording directly slower back.
I don't want to,
yeah.
Appreciate that. I will
Yes,
I will email you, Sham, and then I'm also putting the question in the box as well. Thank you, guys.
Okay. Yes, thank you.
Okay, are there any other questions? All right. If there are no other questions, we sincerely thank you for the time that you've given us today. Thank you for all of your questions, because we cannot move forward unless we have open communication with you. So we sincerely do appreciate that. We'll do our best to get these questions answered and posted out quickly, along with the ones from the February forum. Please remember to go in and register for the for the April forum. It will be April 9th. From 10 until noon. And one last chance for questions before we close. All right. Thank you so much for your time today. We hope you have a great day.